Hey y'all, Tiffany Gladney here, your Director of Policy and Government Relations with the latest advocacy updates. This week, the legislature was bustling with tons of advocacy groups hosting their annual advocacy days. We saw tons of movement with bills related to, of all things, marijuana, school curricula, vaccine mandates, lobbyist fast passes, and of course, Medicaid expansion. There's also speculation that the House budget will drop as early as next week. So let's jump right into it. Of course, House Bill 76, Access to Healthcare Options, which is the Medicaid expansion bill, is now headed to the governor's desk to be signed into law. This bill passed its second and third readings Wednesday and Thursday of this week. But keep in mind that this bill will not take effect unless there is a budget that is voted on, passed, and signed into law. We also saw Senate Bill 324, the Interstate Medical Licensure Compact Bill. This is a Republican-sponsored legislation seeking to increase access to healthcare providers. Senate Bill 324 would create a pathway for physicians to be licensed in multiple states. A physician's participation in this multi-state practice is contingent upon various criteria. So think an evaluation by the physician's home state's member board, for example. Senate Bill 324 passed its first reading Monday and has been sent to the Senate Rules and Operations Committee. Then we saw Senate Bill 337, the Clinical Counselors Accreditation Modifications. This bill was filed Tuesday, March 21st, and it makes changes to the current accreditation system for clinical counselors. Should the bill become law, starting July 1st, any eligible practitioner with a minimum of 60 semester hours or 90 quarter hours of graduate training, including a master's degree, and who have passed the state exam will be licensed as a clinical mental health counselor associate. So Senate Bill 337 has been referred to the Rules and Operations Committee. Then House Bill 421, Medicaid coverage for doula services. This is a fairly new bill as it was filed last week. And should it become law, it would require a statewide analysis of access to doula services, add doula services to the Medicaid program, provide the administration with a $500,000 non-recurring appropriation just to make the necessary changes to the computer systems and administrative systems. House Bill 421 awaits its first reading. And on the early childhood education front, we actually saw some movement with House Bill 398, the Child Care Act. This all Democrat-sponsored bill seeks to reinstate the child care tax credit in efforts to expand North Carolina pre-K, increase child care subsidies, provide free lunch for all public school students, among other things. The bill passed its first reading Monday, March 20th, and has been assigned to the House Rules and Operations Committee. And then we saw House Bill 401, funds for Dolly Parton's Imagination Library. And this bill was filed Monday, and the proposal would appropriate $1.5 million in recurring funding to the North Carolina Partnership for Children for Dolly Parton's Imagination Library, which is an early literacy program that provides age-appropriate books to children on a regular basis to encourage reading. This bill has been sent to the House Appropriations Committee. All right, y'all, it was a lot, but it's all good stuff, right? So remember, you can check out our live bill tracker anytime to get updates on these bills and many other bills that we're monitoring. It's on our website and it'll be linked in the legislative update email. As always, thank you so much for what you do for kids and families. And y'all know the rest. Make it a great one.